Nurse Aide Exam Prometric. Question 1. When a client dies, the nurse aide should: Option A. Leave the room immediately. Option B. Provide post-mortem care. Option C. Call the family. Option D. Remove all personal belongings. The correct answer is option B. Provide post-mortem care. Post-mortem care, bathing, positioning, and preparing the body, is the nurse aide's responsibility. Leaving the room is not appropriate. Calling the family is usually done by the nurse. Removing belongings should be done carefully and respectfully. Question 2. What is the proper ratio of bleach to water for disinfecting surfaces? Option A, 1:1. Option B, 1:10. Option C, 1:100. Option D, 10:1. The correct answer is option B, 1:10. A 1:10 dilution, 1 part bleach to 9 parts water, is the standard for disinfecting surfaces contaminated with blood or body fluids. 1:100 is for general disinfection, not blood/body fluid spills. Question 3. What is the first sound heard through the stethoscope when taking blood pressure? Option A, diastolic pressure. Option B, systolic pressure. Option C, pulse pressure. Option D, pulse deficit. The correct answer is option B, systolic pressure. The first Korokov sound heard is the systolic pressure. This is the pressure when the heart contracts. The diastolic is the last sound heard. Question 4. A client is pacing and appears anxious. The nurse aide should: Option A, ask the client to sit down. Option B, walk with the client. Option C, give the client a sedative. Option D, leave the client alone. The correct answer is option B, walk with the client. Walking with the client provides exercise, reduces anxiety, and allows the aide to monitor for safety. Asking them to sit down may increase anxiety. Sedatives require an order. Leaving them alone may be unsafe. Question 5. Which approach is best when caring for a client with Alzheimer's disease? Option A, use complex medical terminology. Option B, use short, simple sentences and give one instruction at a time. Option C, speak in a loud tone to get the client's attention. Option D, ask open-ended questions. The correct answer is option B. Use short, simple sentences and give one instruction at a time. Clients with Alzheimer's have difficulty processing complex information. Short, simple sentences with one instruction at a time are most effective. Complex terminology and open-ended questions overwhelm them. Loud tones are perceived as aggressive. Question 6. Normal oral temperature range is: Option A, 96.0 to 97.5 degrees Fahrenheit. Option B, 97.6 to 99.6 degrees Fahrenheit. Option C, 98.6 to 100.6 degrees Fahrenheit. Option D, 99.6 to 101.6 degrees Fahrenheit. The correct answer is option B, 97.6 to 99.6 degrees Fahrenheit. Normal oral temperature ranges from 97.6 degrees Fahrenheit to 99.6 degrees Fahrenheit, average 98.6 degrees Fahrenheit. 96.0 to 97.5 degrees Fahrenheit is below normal, hypothermia. 98.6 to 100.6 degrees Fahrenheit includes normal and low-grade fever. 99.6 to 101.6 degrees Fahrenheit indicates fever requiring reporting. Question 7. When providing care to a client with dementia, the nurse aide should: Option A, maintain a consistent routine. Option B, change the routine daily. Option C, avoid eye contact. Option D, speak quickly. The correct answer is option A, maintain a consistent routine. A consistent routine provides structure and reduces confusion and anxiety. Changing the routine daily increases agitation. Avoidance of eye contact and speaking quickly are not therapeutic. Question 8. A client expresses fear about an upcoming procedure. The nurse aide should: Option A, tell the client not to worry. Option B, acknowledge the fear and offer support. Option C, change the subject. Option D, tell the client the procedure is minor. The correct answer is option B, acknowledge the fear and offer support. Acknowledging and validating the client's fear provides emotional support. Dismissing or minimizing the fear, A, D, is not therapeutic. Changing the subject, C, avoids the client's concern. Question 9. When a client with dementia is sundowning, becoming agitated at dusk, the nurse aide should: Option A, keep the environment bright and noisy. Option B, use a calm, gentle approach and low lighting. Option C, give the client a sleeping pill. Option D, ignore the agitation until it passes. The correct answer is option B, use a calm, gentle approach and low lighting. Sundowning is managed with a calm environment, low lighting, quiet, and a gentle approach reduce agitation. Bright, noisy environments are overstimulating. Sleeping pills require an order and should not be the first response. Question 10. Which of the following items is used in the prevention and treatment of bed sores or pressure sores? Option A, rubber sheet. Option B, air mattress. Option C, emesis basin. Option D, restraint. The correct answer is option B, air mattress. An air mattress, or pressure-reducing mattress, helps prevent and treat pressure ulcers by redistributing pressure on bony prominences. Rubber sheets can trap moisture and increase skin breakdown. Emesis basins are for collecting vomit. Restraints are not used for pressure sore prevention. Question 11. When giving a bed bath, water temperature should be approximately: Option A, 90 to 95 degrees Fahrenheit. Option B, 100 to 105 degrees Fahrenheit. Option C, 110 to 115 degrees Fahrenheit. Option D, 120 to 125 degrees Fahrenheit. The correct answer is option B, 100 to 105 degrees Fahrenheit. Water for a bed bath should be 100 to 105 degrees Fahrenheit, about 37.8 to 40.6 degrees Celsius. This temperature is comfortable and does not burn. 110 to 115 degrees Fahrenheit can scald sensitive or elderly skin. 120 to 125 degrees Fahrenheit can cause burns. Question 12. When disposing of contaminated linens, the nurse aide should: Option A, shake them out before placing in the hamper. Option B, place them in a leak-proof bag without shaking. Option C, fold them neatly before disposal. Option D, sort them in the client's room. The correct answer is option B, place them in a leak-proof bag without shaking. Shaking linens creates aerosols that spread pathogens. Contaminated linens must be placed directly into designated bags without shaking, sorting, or folding. Folding or sorting would require unnecessary handling of soiled linen. Question 13. The best way to communicate with an unresponsive client is to: Option A, avoid talking to them since they can't hear. Option B, speak to them as if they can hear and respond. Option C, speak loudly near their ears. Option D, only speak to family members. The correct answer is option B, speak to them as if they can hear and respond. Many unresponsive clients can still hear and may benefit from hearing familiar voices. Speak calmly, explain procedures, and use the client's name. Hearing is the last sense to go. Question 14. When should the nurse aide count an apical pulse for a full minute? Option A, always. Option B, only if the client is pediatric. Option C, when the pulse is irregular. Option D, when the client is sleeping. The correct answer is option C, when the pulse is irregular. An apical pulse should be counted for a full minute when the radial pulse is irregular to accurately count all heartbeats. Otherwise, counting for 30 seconds and multiplying by 2 is acceptable. Question 15. When measuring blood pressure, the nurse aide should place the stethoscope over which artery? Option A, radial artery. Option B, brachial artery. Option C, carotid artery. Option D, femoral artery. The correct answer is option B, brachial artery. The brachial artery, located in the antecubital fossa, inner elbow, is the site for auscultating Korokov sounds. The radial artery is used for pulse counts. The carotid and femoral arteries are not used for routine blood pressure. Question 16. The Heimlich maneuver should be used when a client, option A, is coughing forcefully. Option B, cannot speak, cough, or breathe. Option C, has a minor cough. Option D, is having difficulty breathing. The correct answer is option B, cannot speak, cough, or breathe. The Heimlich is for severe airway obstruction when the client cannot speak, cough, or breathe. A client who is coughing forcefully can still breathe. Encourage coughing. Question 17. A client with Alzheimer's disease becomes agitated when the nurse aide enters the room. The aide should, option A, leave and return later. Option B, approach slowly and speak in a calm, soothing voice. Option C, ask the client what is wrong. Option D, call for assistance. The correct answer is option B. Approach slowly and speak in a calm, soothing voice. A calm, slow approach reduces agitation. Leaving may reinforce the behavior. Asking what is wrong may be too abstract. Calling for assistance may be needed if the client is a danger to self or others. Question 18. When receiving a report at shift change, the nurse aide should, option A, ask questions about unclear information. Option B, write down everything quickly and leave. Option C, ignore information about client preferences. Option D, rely on the previous aide's verbal report only. The correct answer is option A. Ask questions about unclear information. Asking questions ensures accurate communication and safe care. Writing everything down without clarification may lead to errors. Ignoring preferences misses important care details. Question 19. A client with dementia has incontinence. The nurse aide should, option A, place the client in adult briefs without offering toileting. Option B, offer toileting at regular intervals. Option C, restrict fluids to reduce incontinence. Option D, ignore the issue. The correct answer is option B, offer toileting at regular intervals. Regular toileting maintains dignity and may prevent incontinence. Restricting fluids can cause dehydration. Ignoring the issue is neglect. Briefs may be necessary but should not replace toileting. Question 20. When communicating with a client with dementia, the nurse aide should, option A, use complex medical terms. Option B, use simple, one-step directions. Option C, speak loudly. Option D, ask open-ended questions. The correct answer is option B. Use simple, one-step directions. Simple, one-step directions, example, please sit down, are most effective. Complex terms, open-ended questions, and loud tones are overwhelming and may cause agitation. Question 21. A client is grieving the loss of their spouse. The nurse aide should, option A, tell them to move on and focus on their health. Option B, listen and acknowledge their loss. Option C, avoid mentioning the spouse to prevent sadness. Option D, suggest they should be grateful for the time they had. The correct answer is option B. Listen and acknowledge their loss. Listening and acknowledging the loss validates the client's grief. Telling them to move on or that they should be grateful dismisses their feelings. Avoiding the topic leaves them isolated. Question 22. Which activity is most appropriate for a client with dementia? Option A, complex puzzles. Option B, simple folding tasks. Option C, reading medical journals. Option D, watching educational films. The correct answer is option B, simple folding tasks. Simple, repetitive tasks like folding towels provide a sense of purpose and are appropriate for clients with dementia. Complex puzzles in medical journals are too challenging. Watching educational films may not be engaging. Question 23. What is the correct procedure for taking an oral temperature? Option A, place thermometer under the tongue, close mouth. Option B, place thermometer under the tongue, breathe through mouth. Option C, place thermometer between the teeth. Option D, place thermometer on the tongue. The correct answer is option A, place thermometer under the tongue, close mouth. The thermometer must be placed in the sublingual pocket with the mouth closed. Breathing through the mouth or placing on the tongue leads to inaccurate readings. Placement between teeth risks breaking the thermometer. Question 24. When using a fire extinguisher, the nurse aide should remember the acronym. Option A: pass, pull, aim, squeeze, sweep. Option B: race, rescue, alarm, contain, extinguish. Option C: ABCD, airway, breathing, circulation, defibrillation. Option D: pace, pull, aim, contain, extinguish. The correct answer is option A. Pass, pull, aim, squeeze, sweep. PASS is the correct acronym for using a fire extinguisher. RACE is for fire response, rescue, alarm, contain, extinguish. PASS is specifically for extinguisher use. Question 25. Standard precautions apply to which bodily fluids? Option A: blood and blood products only. Option B: all body fluids, secretions, and excretions. Option C: only visible blood. Option D: only if the client is diagnosed with an infection. The correct answer is option B: all body fluids, secretions, and excretions. Standard precautions apply to all body fluids, secretions, and excretions, except sweat, regardless of visible blood, treating all clients as potentially infectious.